placenta. Anterior placenta. It's simple now. What do you understand by the word anterior? Anterior means in the front. I don't know if you understand. Posterior means at back. So if you look at the womb is just like pear shape. I don't know if you understand. So the small one for a woman that has not taken it, her womb is so small that it's not even as big as this hand. So but if you look at that womb, it's just like a pear. So it has a front one that is facing the woman's front side. It has a back side that is facing the woman's back side. So the one that is facing the woman's front side is called the anterior aspect of the placenta. Then the one that is facing the woman's back side is called the posterior aspect. So when we talk about the location of the placenta can be anterior or posterior. So if the placenta is attached to the front side of the woman, it is called the anterior location of the placenta. If it is attached to the posterior side, it is called the posterior side. Then whether it is attached anterior or posterior, you can still have upper, we can still have midline, then we can still have lower. Is it clear? Now when it decides to attach in the anterior side, it can still decide to attach in the upper end of the anterior side, or the middle end of the anterior side, or the lower end of the anterior side. So also is the posterior. It can decide to attach at the superior part of the posterior, middle part of the posterior, or lower part of the posterior. It becomes now important when that location is so low. When the placenta is attached very low, it can be attached close to the os. Os means where the baby comes out from. I don't know if you understand. That pathway where the baby comes out from, that is the os. Now, if it attached very close to the os, or it is covering the os, that is what we call placenta previa. So if it is touching the os, that means this placenta will come out before the baby comes out. That is placenta previa. But that is usually in type 4. But in type 2, sometimes during labor, the placenta can go up. That might not be of a problem. But that is one of the causes of bleeding. So where it becomes important is not whether it is anterior or posterior. What makes it important is the location, as in whether it is low or high. That is just that. If it is high and they decide to be anterior or posterior, it makes no difference. Is it clear? But when it is low and is touching the os, that now becomes what we call placenta previa. And that is the one they might tell you have to deliver by CS. Because if the placenta is already coming out, during labor, the woman will start having severe bleeding. Does it answer your question?